Good morning, good afternoon, or good evening, depending on where you are in the world, and welcome to today's roundtable discussion, a live discussion, pivoting to telehealth opportunities and challenges. My name is Matt Brady. I'm Head of Content Healthcare with Informa Markets in Dubai. Please feel free to submit a question to our panelists at any point in today's discussion. So now on to today's session. So it's my privilege to be joined today by, in no particular order, by Pratik Sardana, who is a Senior Manager and Lead Clinical Strategist at Etisalat, Dr. Osama El Hassan, Head of eHealth Section at Health Data and Information Analysis at Dubai Health Authority, Simon Isgar, who is a Partner and Head of Insurance at BSA, Samar Nasser, who is a Director Healthcare at KPMG based in Saudi Arabia, and Dr. Robin Ol-Anessian, co-founder and Director of Telemedicine 360, who is based in Europe. Welcome all of you, and thank you very much for your time today. So I just want to start by talking around the current situation of telehealth. Obviously, we've witnessed major events over the past 18 months to 2 years, which have taken much of the world by surprise. I just want to share a recent stat from a global survey that we ran as OmniHealth. The survey is called Voice of the Healthcare Industry Markets Outlook. We surveyed healthcare professionals around the world. And one of the insights that we took from the survey was that 67% of clinics and medical practices worldwide identify telemedicine as an investment priority in the coming months. And this is a priority that they placed ahead of technological investments like artificial intelligence, which of course, much of the healthcare community talks around at the moment, robotics, and IoT. So telemedicine is a bigger priority than all of those in terms of investment. But this is especially true of businesses with a particular turnover of 5 to 10 million US dollars. And it's also true of businesses based in this part of the world, so the GCC or Middle East. So in other words, telemedicine is a bigger investment priority in the Middle East among businesses of that particular turnover. So this is where we're at the moment in terms of what the healthcare community thinks or how they perceive telemedicine. I want to ask the panel for your particular perspectives. So if we could start with you, Dr. Robin. You're based in France, in Europe. Would you be able to provide a quick update on telemedicine adoption worldwide? I mean, where are we at the moment, 2 years into this evolving pandemic? How big is it currently? Are there more providers who are now offering telehealth or telemedicine as a service?
Yes, hello. Can you hear me well?
Yep, perfect. You sound great.
Yes, okay, thank you. So in terms of worldwide telehealth growth, what we've seen during the pandemic is a overall increase of services, of providers, of policies as well, in majority of the world. And the growth has been in different areas. Most notably, we've spoke a lot about all the providers, the capital raise, the startups that are now less of a startups growing in this area. However, what the situation showed us was that actually, despite having some providers established in the countries, actually the integration and the usage of telehealth as a daily, normal, standard, routine practice by hospitals, primary care professionals, and allied health professionals was actually quite limited in reality. And when all the countries had to change quickly to it, actually there was some panic and some issues that happened because of technical, legal problems at first, and then came the practices. What can I do? What I can't do during the lockdowns and after the lockdown. So a lot has been changing, but what we saw really was that lack of integration, lack of practice routine from the majority, I would say. Of course, a lot of hospitals have integrated telehealth, a lot of doctors, lots of providers, but this is the top of the iceberg. This is what we see everywhere in the conferences, in the discussions, in the professional world. When we go in the field and the routine healthcare worker didn't heard of telehealth before, doesn't know how to do it, is afraid, and so on. There's a lot of work to do there, and also from government to push policies and supportive work into that.
Thank you. That's really interesting. So you covered a lot of territory there, and of course we'll examine some of these aspects later. So, namely sample, legal, and policy challenges relating to telehealth. But I wonder if we can move to you, Samar, and how is the situation currently in Saudi Arabia and more broadly than that, regionally? Is much of what Dr. Robbins said just now reflected also in the region?
Yeah, absolutely. Thank you so much, Matt. I just want to echo what Dr. Robbins said. So certainly the pandemic has forced the acceleration of the adoption of telemedicine and virtual care. And if we look at just a quick number in terms of comparison, we're now at 40 times more, or there's an increase that is 40 times more in comparison to pre-COVID times. And you know, like if we just zoom outwards and think of healthcare versus other sectors, healthcare has been behind when it comes to innovation, digital adoption, and telehealth in general. But, you know, the pandemic has really accelerated that. And as a result of this, the regulations enabled that and made it happen. And there's so many factors that contributed to that. Number one is from a consumer or a beneficiary standpoint, there has been a willingness because, you know, you can't go out, you can't go to the hospital or see a doctor, but then you can just push a button and speak with a doctor virtually. And then on the provider side or the doctor side, there has been a willingness and also favorability as well. And then all the systems and the, you know, the countries or economies have also, like, how do you say that, supported that by enabling the regulation. So, and I could speak to Saudi Arabia. So if you look at the precautionary measures that Saudi took, one of the first decisions that Saudi took or the Ministry of Health took in January 2020 was the launch of the National Command Center, which contributed significantly to the surge management and control of the supply and demand in the entire ecosystem, whether public or private. The other thing is the leverage of the digital front door. I'm very proud to say that we did this so well. And I started traveling post-pandemic, and I could see the difference when it comes to, you know, using, you know, contact tracing, monitoring. It's run by by Sedaya, or the National Institute of AI. The app is called Tawakkalna. In addition to that, the Ministry of Health has leveraged things like symptom checkers, virtual consultations became heavily embedded with GPs or family physicians at the primary care level with the app Sahati, which even my parents use it right now. I think regionally for the UAE and others, I think they followed footprints, I would say, with apps like Husn's and other, but I think Dr. Osama could speak better than me with regards to the UAE.
That's great. Thank you for that very comprehensive answer. And indeed, Dr. Osama, what is your perspective of telemedicine based in the UAE? So I've written down here your telemedicine service, which is offered by Dubai Health Authority, obviously. How many doctors and stations are there now for virtual consultations? Would you be able to provide an update on that, please?
Okay, thank you very much for. So before I start, I just want to correct my title. So I'm a specialist at the Health Informatics and Smart Health Department at the regulatory arm of Dubai Health Authority. Also a board member of the International Society of Telemedicine and eHealth. So before I start, I should put some sort of and start at the beginning of the story of telehealth in the UAE. So we started an experiment around developing a regulatory framework for telehealth back in 2016. It was a small exercise trying to put the outlines of how we can start this journey from the regulatory perspective. And we developed a small document around that. It was the first standards of telehealth in Dubai. I think in 2018, we got a very strong push through the program called Doctor for Every Citizen, which was basically an initiative came from Sheikh Mohammed, His Highness Sheikh Mohammed bin Rashid, the ruler of Dubai. That in 2018, he put what we call the 50-year charter launched by him. There was an article, which actually the fifth article was talking about developing a Doctor for Every Citizen program in Dubai. And from that time, we started to develop actually the program from both the regulatory point of view and the implementation point of view, at least at DHA. And we launched this program in 2019. It was hosted by the primary care team, and they developed a platform which includes almost 10 family doctors who are equipped with the telehealth platform. And it was a 24/7 service. When we started back in 2019, it was I can say that it was received very well. However, the number, of course, was not that big. When the pandemic started in 2020, we witnessed a huge surge of services, service consumption. And I believe in 2020, we received almost 83,000 calls, and I believe like 7,000 out of them were dedicated to COVID cases. So you can see that how much surge we got only just for the pandemic. And we kept working on that. We even within the pandemic, we try to encourage the private sector also to join this journey by trying somehow to relax the regulation that we put forward in 2018 and 2019 to let them start their journey. And we gradually try to incorporate them in those regulations. And I believe now we have a very, very strong and very successful program for licensing both providers and even telehealth platform providers to be part of this regulated journey.
Thank you for that. That's very interesting, and that's a really quite remarkable surge. So, Pratik, if I could ask you a question now relating to Etisalat, of course, and so we see that Etisalat has evolved its telehealth services. But would you be able to explain or elaborate more on the current state of telemedicine or telehealth provided by Etisalat, and also where is demand currently coming from?
Yeah, absolutely. Thank you for that, Matt. And I would like to begin by thanking all the audience that has joined us today from different parts of the region. Telehealth continues to be an emerging topic, and I'm choosing my word carefully here. It is an emerging topic. I don't think we've kind of settled things around telemedicine from either the technology standpoint, the use case standpoint, or the regulatory standpoint. And in years to come, this needs to be seen how it grows. But it has shown us the promise and the potential that we saw during the surge of COVID-19 and that we continue to see now as well. And I would sort of share some of the sentiments that have been shared by other panelists that spoke before me today. Dr. Osama spoke about how the Dubai Health Authority started their journey in putting together the right regulatory frameworks to support telehealth as a technology that will enable access to care, and that's important. And they started well before the COVID-19 pandemic actually hit us. And so what we've seen in UAE is different regulators, be it Department of Health or Dubai Health Authority, having this vision which goes beyond what the current market needs are and looks into the future. And we're able to conceptualize this before the pandemic even hit. Now, in Etisalat, we started looking at telehealth strategies before the COVID-19 as well. We were engaged in some of the discussions with the Dubai Health Authority and other regulators in the region as to how we, as a telecom provider, with a growing digital arm, can support such technologies for the healthcare sector and play a role in enabling access to care and different other use cases that come with telehealth. And I must say that COVID-19 did act as an accelerator for us as well. Now, we started off with one of the use cases, which is virtual outpatient consultations, which I think was the primary use case that was brought into light during COVID-19 that saw large-scale acceptance and surge. And since then, we've realized that we really, to harness the true potential of telehealth, we need to be able to look at the entire continuum of care and then enable different touch points in that continuum of care to allow patient better access to health services. And so that's how we've kind of evolved our technology strategy, if you will, in telehealth, growing from virtual outpatient consultations. Now we are trying to address other use cases in that continuum, including remote patient monitoring, satellite clinics, which don't have access to specialty services, inpatient use cases such as tele-rounding, tele-ICU, telestroke, and so on. And so the list is quite long, but it's important to note here that we are looking at telehealth not just from a single use case standpoint, but from the entire continuum perspective.
That's super interesting, thank you. And I'll be asking you a question later in relation to the user experience specifically. So, but my next question will be for Simon. So I quoted from a survey that we did recently at the beginning of a discussion. There was another survey. This is a local survey. And according to this one, 55% of respondents said that they didn't know if their health insurance provider, I quote, offered access to telemedicine. So there's a lack of awareness among local patients, perhaps. What's being done to address this awareness challenge?
Well, good afternoon, everybody, or good morning, wherever you are in part of the world. I'm very honoured to be speaking at this event today. It's a very interesting question because going back to my colleagues who've already spoken about the COVID-19 pandemic, that in fact has, I would have thought, sort of the public would be aware of this service. And we have seen those trends possibly in Europe. But what is, in fact, what's interesting, what is being done, the regime that we have here, the sort of legal frameworks, we have mandated medical insurance both in Abu Dhabi and Dubai, and to some extent in the Northern Emirates. We do have, it is somewhat fragmented, but what these regulators are doing, which is a positive spin, I think, on things, is to mandate that as a benefit within these compulsory medical insurance policies. Of course, by doing so, that benefits to a large extent the insurance companies as well in terms of sort of cost savings. But going back to my sort of colleague's earlier comment, it's not an easy thing to do. And the awareness, I suspect, is because we have so many different players in the market. So, for example, we may have a health insurance company that operates through a third-party administrator that has a network of provider hospitals who then deals with those providers who then have specialist telemedicine units who are also licensed either by the Department of Health Abu Dhabi or the Dubai Health Authority, or if it's in the Northern Emirates, it's the Ministry of Health and Prevention. So there are those complexities, but perhaps where awareness will come forward, I think, will be through these mandated benefits within the policy, which does help everybody. But of course, those benefits would be limited to some extent, non-emergency and things like that. And how far do you take the use of that? What I have seen prior to COVID was interesting because I do quite a bit of work with some of the international private medical insurers around the world. And they have been well into, so the really large US healthcare providers, for example, your Aetna Cignas have sort of been on top of this prior to COVID, and they have quite advanced telemedicine schemes. Again, they have these sort of issues around the fragmentation in the US with states, but they've sort of been on top of this. And one precursor to telemedicine prior to COVID was a concept of what we call second opinion. So many medical insurers have this extra add-on benefit that they're allowed to have a second opinion, and that's normally done through a digital platform as well. But the way really forward, depending on which jurisdiction you're in, whether it's the UK is obviously different because we have a national health service, as opposed to being here in the Middle East where it's all mandated insurance in most of those jurisdictions. It's how you get the awareness. And the other factor, of course, is you need the patients to be comfortable with having a remote session, of course. We're all on this remote session now. I often have been involved with mediation arbitration hearings remotely. I'm finding that a challenge. So it's also getting patients on side as well.
Thank you. That's a really powerful observation. Of course, we are all connected through this amazing medium, and it's all live. And this could be a virtual consultation in a sense, which leads on to the next question, which is more relating to a patient experience and a physician experience. Let's talk about the user experience. I think telemedicine, I mean, if we view it in terms of, well, it's like looking at your phone or your laptop screen, then it's not a difficult concept to visualize. It's something that we can easily embrace. But nonetheless, there are certain challenges, I guess. And, I, for one, can see how, telemedicine will have a powerful a benefit in terms of delivering mental health services, for instance, but maybe there'll be limitations in other areas. So anyway, I'll ask Samar the first question, which is relating to how we can deliver a better patient experience through telehealth or telemedicine on a whole. What's your perspective on this? How can telemedicine enable a better patient experience?
Sure. Very good question, Matt. So I think it goes down to cost, quality, and access. And I could summarize this in three big themes that we're seeing right now. So the first one is, how do we increase the convenience to receive routine care? So the digital front door, it's becoming a buzzword now. How can we create or leverage a broader access to digital front door with the integration, let's say, of virtual triage and virtual consultations? to provide a better experience for consumers and beneficiaries. I don't like the word consumer, so I keep using beneficiaries. The second theme is how can we expand beyond, routine care or chronic care, let's say, let's say into like mental health or other specialities with the leverage of out of hospital care, remote monitoring, and of course, and bundling all of this with, home health care and nurse visits, for example. And the last one also is, expanding to specialities that we didn't put on a virtual platform from before, but for special cases like rural or remote areas, for example. And we see this a lot in Saudi Arabia. I do think that the foundation of all of this is primary care. We also just launched a Doctor for Every Citizen program, similar to the UAE, the program that Dr. Osama has highlighted. And the virtual consultation and telemedicine is a very strong component or building block of this program.
Thank you for that answer, Sama. Pratik, I would like to ask you about design in particular. So Etisalat strikes me as a very technological company. And if you look at all the great kind of tech companies of today and the startups, they all have this kind of same ethos, which is gathering data all the time from its end users and using that data to inform better decisions. And of course, all these platforms and applications, they keep changing all the time based on that data that comes in. How does it work for Etisalat? So I've written down here that based on my understanding, Etisalat's design experts designed your virtual consultation platform based on end user feedback from doctor and patient groups. How does that work in practice? And what are users looking for specifically? And also from Etisalat's perspective, what makes a good telehealth user experience?
Yeah. So user experience for us has been a key area of focus because we understand, and this cuts across telemedicine. This is talking about technology in general. If the user experience is not optimal and not designed for an intuitive experience, then the adoption of such technologies suffers at the end. And when adoption suffers, then technologies tend to fail. So this was a key focus for us as to first identifying who would be the day in and day out users of a virtual outpatient consultation platform that we launched. And we identified the two major user groups are clinicians, admin users, and clinicians being on one side of the coin, and then patients on the other. And it's critical to understand the two different environments, technical and physical environments, through which these two users are trying to access telehealth technology or platform. And because both have challenges on their ends, right? So this was very important to understand. So we then took the help of our co-creation lab, which have design experts, as you said, who went around and interviewed doctors as well as patients and other clinicians and try to understand their perspective from a technology standpoint first, and what would be the right user experience for them, and then also drilling down more into use case specific feedback as to telehealth, what they would like to see and what would make a user interface more intuitive, easy to use, and will facilitate adoption. So this was very key. And so based on and the feedback that we gathered from these two main groups of users, we were then able to go back to the drawing board and design our user interface and the technology, right? So this was key for us. What we understood is that for clinicians, it's really important to have a single user interface as opposed to multiple windows through which they can access the platform. Now, key here is to ensure that the sanctity of data remains intact between the different platforms that they're using to maintain patient records. So typically doctors, talking about a hospital setup, would have a hospital information system or electronic health record, which we've integrated with our platform. So they're trying to access patient data on the telehealth platform, as well as on the hospital information system or the patient or the electronic patient record. Now, how do we make it easy for them so that they don't have to sign into different platforms, so that they don't have to juggle between different interfaces, was absolutely key in ensuring how their experience is going to be and how they're going to adopt the technology. On the patient side, it's more challenging, the environment, because although we can ensure, and in UAE specifically, we've got extremely good mobile connectivity and data connectivity. The outreach to individual households of internet connectivity is extremely good when compared to other parts of the world. But then the challenge is that how do we control the endpoint devices, right? So patients are using Wi-Fi routers at home. They're using mobile phones, laptops. Some of these endpoint devices may not be updated, may be outdated. I'll give you an example. Patients who were using Wi-Fi, for example, to connect, to telehealth platform, that the same Wi-Fi during COVID-19 were being used by other members of the household because they were working remotely, right? So there was far more number of devices tapping into the same Wi-Fi bandwidth for IPTV, for conference calls, children in the household connecting remotely for education, so on and so forth. And so that really narrows down the bandwidth that telehealth, a video consultation would require, right? So this is a challenge. And so how do we address that, even though the connectivity is pretty good, but the devices is very difficult to control? So here, what we thought would be best is to enable tools that give visibility to the patient on their connectivity itself, right? So a window inside the telehealth platform that would show them what's the connectivity they have, is the connectivity good or not. Other tools which guide them in terms of whether their video camera is connected, whether their microphone is working. So this gives them more visibility and control so that they know where the issue is and they can rectify it, right? And so this was key. Otherwise, this is very difficult at times for patients to know what's going wrong as to why they're not able to see the doctor on the other end, why the video is so choppy, etc. So this was key. Now, the other thing was to also ensure that we enable all the different, workflows that are required for, let's say, a teleconsultation to take place, right? So we wanted to ensure that we enable all the technologies required for that workflow to be implemented. So from having payment gateway integration, having a cloud-based platform, ensuring privacy and security parameters in place, ensuring digital consent can be taken, ensuring patient feedback and doctor feedback or clinical feedback can be taken. So all these are different sort of sub-workflows within the entire workflow for teleconsultation that needed to be enabled. So this was critical for us. Again, a lot of focus and thought was put into to the user experience, because we understood that, for this to be successful, not just in the short term, but in the long term, we really must address the user experience.
Thanks, Dr. Pratik. That's a really, really comprehensive answer and super interesting. And something you mentioned earlier in your response was around the single user interface, which is great. So, I mean, it simplifies the experience somewhat. In fact, this leads me on to the next question for Dr. Robin. which is around training. So we have all this amazing sophisticated technology, but is there like a training deficit? And this relates not just to, the tools and technologies themselves, but also data perhaps. And we all talk around data, but do they really, understand it? Is there more training that's required?
So the answer is definitely yes for this question. And more training is necessary for everyone, for the healthcare professionals, the healthcare managers, and all healthcare professionals, not just doctors, but really everyone, because telehealth now is not only growing for doctors, but as well.
I think you're frozen there. That's a Robin. You're still there.
Professionals about. Can you hear me?
Yeah, sorry, just stuttering a bit there because of the technology, which is ironic. Would you be able to repeat that last point, please?
Yes, sorry. I was saying that the question is, what should we train the healthcare professionals on? So the technical component of it is actually not that necessary, because once you get great apps, great software, like it was just described before by Etisalat, actually you don't need a training. It should be used by itself the same way you use your phone. And in any case, that training should be done by the provider, the same way that when you buy a tool, you have the provider that explains to you how to use the tool. But I don't think that's the question. The question is, how do we train people in actually practicing health remotely? That's the question. And that question for now has very limited answer, because two things. Today, the universities and medical schools are not built to teach about remote medicine or telemedicine. I'm not saying remotely teaching medicine, but teaching remote medicine, different things. Because the deans, the professors are not experienced to it. So that may be the first time where actually the teacher don't have the experience yet on it. That's the other point. And the third point is that until now, maybe the majority of the knowledge has been within the healthcare professional practicing on the platforms. And so the knowledge that has been acquired is not publicly shared or published scientifically for now, or in any textual textbook. So, for example, how do we examine a throat in a telemedicine consultation? How do we examine an eye? How do we check patient respiration rhythm without necessarily needing connected devices? Because yes, with the phone you can get or with a watch or whatever, you can get the heart rhythm, you can get many things, you can get digital stethoscopes and so on. But there's still things that, at least for now, you can't do, and you need to know how you examine that, how you go to the semiology, to the remote semiology. I mean, the semiology examined remotely, and this has to be trained in initial education in all medical schools all around the world. This has to be done in continuous educations for all practicing health doctors. Obviously, it's not done yet. To maintain quality, because it's easy to open the camera and just speak and see, okay, are you good, are you bad, yes, no, etc. But that's not what medicine is. So really, this is very, very important. And we actually did 2 national surveys in France about that, which is the first in the world to have done this kind of surveys. We surveyed all the deans of medical schools in France, and then we surveyed the medical student and the medical resident. And what we found is that all of them wants to be trained. All of them, the high majority says that they are not trained enough and want to be trained more. But there is limited, time and effort from the management to integrate this and do it. However, in France, we managed to integrate that into the official curriculum. So now all medical schools have to train the student about it. The other thing we did is a study with more than 10 scientific societies in France. And we asked them about that question, and they all said the same things. We need to improve the quality of medical examination done by telemedicine training. This needs to be done in medical school and continuous education. But to reach that point, we actually need to do research and publication on what are the best ways to do it. What is the best way to examine a belly remotely? Should we ask the patient to touch his own belly and see if there is a reaction? Actually, that's what's happening now already. The doctors are trying, it's empiric work, the same way that in the past 100 years, the doctors empirically try to find the signs and symptoms and so on. We are at that stage. We need to promote that, and we need to promote collaboration between private providers, universities, hospitals, doctors, scientific societies to actually push that forward. Thank you.
Thank you for that. And let me go on to the next question quickly, which is for Dr. Osama. And would you be able to describe the response from physicians and patients here in Dubai? So what are they looking for from Dubai Health Authority in terms of telemedicine?
Thank you very much. So as I said, during the pandemic, so telehealth was kind of a final solution, but at least resume the relationship between doctors and their patients despite of the lockdown. So this was not an option at that time for us. So gradually, when we reached to kind of the new normal, so now doctors are thinking twice using telehealth. So now they want to make sure that when they exercise telehealth, they should do it boundaries of regulations, with the boundaries of ethical considerations. And also there's another issue that they need to tackle is to manage the expectations of the patient as well. So whether this kind of service is actually equal to in-person care or not, and what will be the difference for us. So we need to manage the expectation of the patient, as well as making sure that we exercise the telehealth within the boundaries, the accepted boundaries. So now, as a regulator in DHA, we've already started to design some sort of new clinical guidelines that can help doctors to understand where are the borderlines, where they can exercise, where they can prescribe, for example, this medication but not this medication. And now we are rolling out those clinical guidelines per specialties and sometimes per disease. And I think that this is the only way to make sure that doctors are exercising telehealth with comfort, without having any of those kind of ethical issues. So this is very, very important. Another part that I need to highlight as well, so this is not on the clinicians, but on the hospital side or the administrations of hospitals. Now they need to think twice. So during COVID, this was a long-hanging fruit to keep business going, but now they have to look into telehealth or virtual care as kind of more strategic view. So we don't think about telehealth as just a way to continue the relationship with our patient in terms of fee-for-service. So I think this will not continue. This is not sustainable. They need to think about new models of care, new ways of bundling virtual care or telehealth with other services as well. So telehealth will be bundled with other service that includes also in-person contact. It could include also having services from third parties like home care deliveries, taking samples by third parties, sending nurses or test collections to home. So we need to bundle these services, and virtual care will be kind of more strategic uptake for those hospitals. Otherwise, telehealth will not be sustainable. Thank you.
Thank you, Dr. Etisalat. And you mentioned an interesting word there, which is ethics, earlier on in your response. And so, Simon, would you be able to elaborate on the legal risks of telemedicine from negative patient outcomes? So, this is a novel concept still, I think. And so have there been any lawsuits emerging around the world in relation to telehealth?
Yes, I mean, it's a very interesting question, and often I was recently advising a global client on a project, and it is quite interesting how they may not see these risks because it's a very new concept in terms of both regulation and law. But going back to my earlier colleague's comments, actually on the training and using more than one device, for example, on one internet. This is a good example of where the system might fail. So if data accuracy is misdiagnosed, for example, there's been some lawsuits around that, and that's purely because there's been issues around the internet bandwidth. It hasn't been enough, or going back to the training point, the clinicians don't really know how to use it. So there is an exposure there generally. And that has to be either through training and a reliable sort of internet bandwidth system as well. So that's sort of one area that we advise clients on, specifically around the training, that the clinicians should know and how to use these systems. Again, it's quite a new area. The other point, of course, is the medical liability. So we all know medical liability in a standard form of person to person. Is the standard of medical liability currently fit for purpose for telemedicine? I'd probably say it's not. We would have to look at a different standard. Does your malpractice liability insurance cover you for any issues? I mean, generally, you'd be looking at errors and omission. I'm going to talk about interruption of services, which I've mentioned. So it's also looking at the aspect of are these services, telemedicine services, digital services through medicine, insurable as well? That's another interesting point. And of course, when one is prescribing controlled substances, so drugs, again, there's a risk of exposure there, both to the clinics, the physicians, and actually all parties involved. So your payers, as we call them, insurance companies, payers, on the one hand. So going back to my early point that we were recently given some advice on quite a unique setup for a client. All of these issues were discussed at length, and the client was then aware behind this. And of course, there are probably several other risks that lawyers have not picked up yet, because sort of generally speaking, there are lots of unknowns with how sort of telemedicine is procured as a general matter of law. And it's like with any technology, I don't think the law has kept pace with the technology. And we've seen that in other industry sectors as well. So there is a bit of a lag with that technology, with the law and the technology on this point. And that's the example I've given there is on the medical liability side. And whether it's possible to insure those risks and whether those risks can be assessed properly. But that's sort of probably a general overview of where we are with those risks. But again, as I go back to my other point, that what we've seen a lot is a lot of the physicians and providers don't really, in our view, need that training, and that's something that has to be rolled out, as my colleague said, at a very early stage, when they're in medical school, for example. And just an analogy with that for lawyers, you all know that we have these concepts now called smart contracts. So we will see lawyers eventually learning coding, probably not my generation, but much younger lawyers. So it's a good analogy where young medical students will have to get to grips with all of this.
Thank you. That's really interesting. And this brings me on to the next section. We'll keep this nice and short because then we have to address one or two questions from the audience. But you mentioned how the law is not keeping up with the latest tech trends, Simon, and we see that in other sectors or industries. And so based on that, Dr. Robin, very quickly, would you be able to provide an update on regulatory trends in telehealth worldwide? So what are the key kind of prevailing trends impacting telemedicine around the world?
All right, very, very shortly. Can you hear me?
Yep, perfect.
Yeah, okay. So, few things. Before pandemic, very few countries had some regulations, mostly Western Europe and North America, and few bits of regulations in Asia as well, and South America, but more limited. Most of those regulations are actually quite limited in scope and do not include all potential use case scenario, as well as all types of legal needs that needs to be addressed, as well as all types of telehealth that can be done. For example, some regulation just speak about teleconsultation or tele-ICU, but they forget remote patient monitoring or tele-expertise or other things. What we are seeing now is that many countries during the last 2 years, and mostly in 2020, issued temporary regulations to allow temporarily telemedicine to be practiced by doctors, even in countries which had a huge opposition, for example, in South Korea and in Brazil, which were already engaged, could do even more extension and ease the practice, like in Canada, USA, France, UK, Australia. Now, and we are actually doing some work on this in different continents, different countries, in Middle East, in Asia, Pacific as well, where we see that now the Ministry of Health are understanding that they need to build their telemedicine regulations. But to build that, it takes actually lots of time because the maturity is low, because the legislative system is not strong as well, many stakeholders, and difficulty to go there. So I would say, as a conclusion, it is a positive note. More countries are developing regulations that can protect the patient and the doctors and the providers in the practice of telemedicine. It's still slow, needs to be quicker, but I'm quite optimistic in how things evolve.
Super. Thank you very much. And Pratik, just very quickly, would you be able to provide a perspective on regulatory barriers from your point of view? So, what existing barriers are there that should be surmounted in order for telemedicine to flourish?
Yeah, I mean, regulation is, again, an evolving topic. And it's quite challenging, I can imagine, for the regulators to keep pace with how technology is evolving. Nevertheless, I think regulators around the world have woken up, and they're doing a pretty good job. I can speak about UAE, where the regulators have really taken into account how the technology is evolving, including telehealth, and accordingly, they are ensuring that with the use of these technology, we don't, number one, compromise patient safety. Second, we ensure that a certain quality of care is delivered. Third is about ensuring privacy, data privacy, especially with respect to patient health information, right? So I think regulators are quite cognizant of this, and this is, I think, and Dr. Osama would bear me out on this, but I think they are quite cognizant of these main objectives that they are trying to address through regulations. Now, is regulation a barrier so far? Well, regulations only become a barrier when they are ambiguous, right? And so one of the key things that regulators must do is to make the regulations easy to understand for everybody, so that then they are, less skeptical about what could be the regulatory impacts if they were to include a certain technology, such as telehealth, in their practices. So this is key, is to, again, to have more consultative process with the industry and try to educate the industry about what regulations truly mean as they emerge, and sort of develop that transparency in information, so that it's easy to understand, and one can perceive what could be certain areas of impact when it comes to regulation. Now, the other thing is, sometimes when regulation is overt, then we tend to see that, in smaller markets, and I'm not talking about bigger markets like the United States, but maybe smaller markets like UAE, is that regulations tend to have, a cost implication as well. So, for example, if I were to include certain certifications into ensuring a telehealth service, then ensuring those certifications has a cost implication. Now, if the regulation is overbearing in terms of its requirements, then those costs quickly add up. And in smaller markets, it then becomes expensive for a provider to use those technologies and develop services around it, right? So this is a key area of, I think, consideration. But having said that, the priority should always be given to patient safety, data privacy, and quality of healthcare. So this is absolutely key, and there should not be any compromise there. We just have to find the right balance as to how regulations evolve, making sure that these objectives are taken care of, but at the same time, it's not overbearing on the market itself, given the size of the market and the scope of services being envisioned through that particular technology, in question.
Okay, thank you for that, Pratik. So you mentioned data privacy or data privacy, and so that relates to one of the questions that we've received from the audience. So what actions have been undertaken to assure patients that their teledata is protected? So this relates to the protection of health data. Simon, is this something that you can address now very quickly?
Yes. We've had what is known as ITC law. So it's essentially a data privacy law related to healthcare, which is called Federal Law Number 2 of 2019, relating to information technology communication. So it's specifically around the healthcare sector, which is very similar to the US HIPAA law, and it protects any data that is processed, controlled through digital platforms, and at a federal level. So it was quite a groundbreaking when it was sort of promulgated in law here, because we didn't really have anything at federal level. We actually had all fragmented laws in the different sectors and at the different emirate level at that point in time. What this law essentially does at a federal level is have a very high-level principles of how data should be protected and it should be processed, and the security around the data and the transfer and portability of the data out of jurisdiction. So it gives an overall framework, and then it then said to each of the emirates to actually sort of fill in a number of those gaps. So the Department of Health Abu Dhabi have got a very extensive guidance on this and where and how you can move data out, or if you cannot move data out. Generally, there are certain requirements to retain data within the jurisdiction and how it's sort of processed. So this was again quite groundbreaking. But what's more important, actually, we are about to get here an equivalent of a GDPR. So those of you that don't know that, I'm sure many of you will, which is the General Data Protection Regulations of Europe, which all of the European Union has adopted, including the United Kingdom. We will have an equivalent of that here at some point, hopefully next year, where it will sort of take away this fragmentation and bring everything together, and including healthcare as well. But as I said, this is very specific to healthcare. And then generally we have other laws and that deal with privacy protection of data, including the UAE Constitution, for example.
Thank you for that. So we're running out of time, unfortunately. I wonder if we can address maybe one or two more questions to wrap this up. So again, another question from the audience, and this is relating to telemedicine enhancing and not just replacing traditional face-to-face consultations in mental health. So do you see technologies like AI, VR, medical devices being incorporated in teleconsultations soon? Is this a question that you can answer, Samar? So from your perspective, do you see technologies like AI being incorporated into teleconsultations, and can they replace the human element? So, this is a question that was posed by another member of the audience. Is technology the answer, I guess? Yeah.
Thank you so much. No, it's a very good question. I don't think AI can replace the human element. I think AI supports or increases accuracy and productivity and so forth, but it will never replace the diagnosis by a real physician or a doctor. I think with virtual consultations, and this is something that, again, we're seeing with the Saudi Ministry of Health, is we're providing access in remote areas and rural areas of Saudi Arabia. It's being compensated with virtual consultations, but then, what about the human element? And the way we're looking at this as a hybrid approach. So the doctors would rotate in these sort of primary care centers that are outside urban areas and big cities. But then the other piece is basically how do we leverage home health care and out of hospital care as well? So I don't think the human element will completely disappear with virtual care or telemedicine. I do think that it will continue to be a hybrid approach on the virtual side of things. With AI, I think it's just to augment the way we diagnose and see things, but will absolutely never replace doctors, in my opinion.
Fantastic. Thank you for that. And let's have one final question, which is a very, very quick question. So a question to all the panelists. So where do you see telemedicine in 2030? So if we were to come back here in a few years' time, unlikely, what would telemedicine look like? And Dr. Osama, if I can ask you this question first.
Thank you very much. That's a very good question. So I believe that telemedicine will be the only way for us to help from the technology point of view, moving from the normal fee-for-service care models to value-based care model. And I think telemedicine can help us a lot with that. We will find telemedicine interleaving with more digital healthcare workflows. We will see more of even new models like virtual hospitals coming to the scenario of the healthcare ecosystem. We see more of responsibilities are moving from the doctors to other allied health or other clinicians or like nurses, whatever, and keeping the doctors focusing on the most valuable and most challenging exercises and leaving all those other activities to other members of the care team. Thank you.
Super, thank you. And Dr. Robin, where do you see telehealth in 2030? Very quick answer. Dr. Robin? We lost him? Okay, let's, Pratik, telemedicine in 2030. What's your vision?
Yeah, I think telemedicine is going to evolve in different aspects over the years. But I think data would be one of the key areas in which telehealth is going to evolve. Currently, a lot of the patient data that we collect is a snapshot in time, which is when the patient actually walks into a hospital or a doctor's office. We are starting to collect more and more data from patients' natural day-to-day environment, such as home or workplace, something we're starting to coin a term called patient-generated health data, which is more from their natural environment. This is a true reflection of what a patient goes through on a day-to-day basis. And I think this is going to be key, how we utilize this data, how we collect it and then utilize in terms of driving insights into patients' health and natural environment to then accentuate telehealth services that will improve clinical outcomes for chronic patients and other types of patients. I think this is how it's going to evolve in the future. 2030, we'll definitely have now 5G and 6G technologies being implemented. So data will be much more real time. And so this will also enable quick decision-making, instant, immediate decision-making using remote technologies in telehealth, and then allowing timely decision support for clinical folks, overall impacting the clinical or the health outcomes.
Super. Well, that sounds great. And on that note, that's it for now. So unfortunately, we can't continue this conversation as fun as it's been. So thank you very much to our distinguished speakers today. It's been a really, really interesting and insightful conversation around telemedicine. So on that note, thank you and goodbye. And thank you also to our attendees who've joined today. Thanks for sticking around for so long. All the best.